Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Breast cancer, hormonal and targeted therapies. Introduction. Breast cancer is the most common type of cancer in women worldwide. Your healthcare provider may recommend hormonal and targeted therapies for your breast cancer. This program will help you understand the benefits and risks of hormonal and targeted therapies. Cancer and its causes. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Cancer happens when cells keep dividing and growing without the normal control. Cancer cells may also spread to different parts of the body through blood vessels and lymph channels. Cancer treatments are used to kill or control these abnormally growing cells. Cancers in the body are given names depending on where the cancer originates. Cancer that begins in the lung will always be called lung cancer even if it has spread to another place such as the liver, bone, or brain. The cause of cancer in a patient cannot usually be specifically determined. Each cell contains hereditary or genetic material called chromosomes. This genetic material controls the growth of the cell. Cancer always arises due to changes that happen in this genetic material. When the genetic material in a cell becomes abnormal, it loses its ability to control the growth of the cell. These sudden changes in genetic material can happen for a variety of reasons. They may be inherited from parents. Changes in the genetic material may also happen due to exposure to specific infections, drugs, tobacco, or other factors. Breast cancer. Breast cancer can happen in women after puberty and becomes more common as women age. Breast cancer may also happen in men, but this is rare. Hormones are chemicals in the body that help regulate body functions. For instance, the hormone estrogen helps control menstrual periods in women. Breast cancer is sometimes influenced by hormones. Some patients take medicine that gives them additional hormones. These hormonal medications may also affect breast cancer. For this reason, your healthcare provider will want to know information about your menstrual periods and any hormone medications you may have taken. Early forms of breast cancers have not spread to other parts of the body. Breast X-rays, also known as mammograms, help healthcare providers find early forms of breast cancers. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Stages of cancer. Once the cancer is found, it is important to determine how much the cancer has grown. It is also important to determine if the cancer has spread to other parts of the body. These two pieces of information help your healthcare provider determine the stage of the cancer. This stage is used to determine the treatment that will be recommended. Your breast cancer was carefully analyzed by a pathologist. The pathologist is a healthcare provider who examines a sample of your cancer under the microscope and performs special tests to help determine whether treatment with hormonal medication is recommended. Your healthcare provider will tell you what stage your cancer is in. Treatment. Surgery helps remove lumps of cancer, but it may not be possible to remove or kill every cancer cell. Cells are very small. 1 million cells can be the size of a ballpoint at the end of a pen. 1 million cancer cells would also easily fit within the eye of a common sewing needle. Even with the most advanced equipment, Cancer cells that cannot be seen or felt may be left behind after surgery. Your healthcare provider may recommend additional treatments after surgery. These are known as adjuvant treatments. Adjuvant treatments may include further surgery. Adjuvant treatments also include radiation therapy. Adjuvant treatments also include drug therapies. Drug therapies may include hormones, chemotherapy, biological therapy or immunotherapy, targeted therapy. These additional treatments reduce the risk that the cancer may recur, but they do not guarantee it. For this reason, your healthcare provider will want to continue to follow you in the months and years ahead, even after the adjuvant treatments have ended. If the cancer should recur, additional treatment may be used. Hormonal therapy. Hormone therapy is often used after surgical treatment to reduce the risk that the cancer will return. It may also be used to shrink a tumor before surgery. Hormonal therapy is also called anti-hormone treatment. If lab tests show that the tumor in your breast has hormone receptors, then hormone therapy may be an option. Hormone therapy prevents cancer cells from getting or using the natural hormones they need to grow. LHRH agonists are a hormonal treatment available only for women before menopause. LHRH agonists can prevent the ovaries from making estrogen. This medicine may be given as an injection under the skin in the stomach area. Options for women after menopause and men may include aromatase inhibitors like anastrozole, exemestane, and letrozole. These drugs prevent the body from making a form of estrogen called estradiol. Common side effects of aromatase inhibitors include hot flashes, nausea, vomiting, painful bones or joints. Serious side effects include thinning bones and an increase in cholesterol. Another treatment option available for pre- and post-menopausal women and men is tamoxifen. Tamoxifen is a form of hormone treatment. You may hear it called other names such as Nolvadex or Soltamox. Tamoxifen can help prevent the original breast cancer from returning and help prevent the development of new cancers in the other breast. It can also help prevent breast cancer in high-risk patients who do not have cancer. Tamoxifen is given in pill or liquid form. It is usually given for 2 to 5 years. If tamoxifen is given for less than 5 years, some women may be given an aromatase inhibitor to complete the 5 years. Side effects of tamoxifen are usually mild. The most common side effect is sudden sweating, flushing, or feelings of warmth, also called hot flashes. These episodes may happen as often as several times a day and usually happen less often over a period of months or years. Tamoxifen will often, but not always, stop the function of the ovaries and may stop a woman's menstrual periods. Women may experience vaginal discharge or dryness. Vaginal dryness may be treated using a water-based lubricant, such as Replens. Women should use some method of birth control while taking tamoxifen, even if their periods have stopped. Tamoxifen could sometimes upset the stomach the first few days it is taken. This usually goes away even if the medication is continued. If nausea is a problem, take your tamoxifen after eating. Women who take tamoxifen have a slightly higher risk of blood clots. This risk is similar to the risk taken by women on birth control pills or estrogen hormones after menopause. There are slightly higher risks of cancer of the uterus and liver in women who are taking or have taken tamoxifen, but this complication is rare. It is still important that women have regular pelvic exams and pap smears. Tamoxifen also seems to increase the risk of strokes. See your healthcare provider or get emergency help immediately if you have signs of a stroke. Signs of a stroke include slurred speech, loss of coordination, weakness or numbness in an arm or leg, eyesight changes, severe headache. Some medications, especially some antidepressants, may decrease the effectiveness of tamoxifen. Check with your healthcare provider to make sure you are not taking any medication that will make tamoxifen less effective. Other medications, such as warfarin or Coumadin and rifampin, may also interact with tamoxifen. Possible side effects of tamoxifen include headache, muscle or joint pain, skin rashes, tiredness and lack of energy, swelling of the hands, feet, or lower legs. Other side effects of tamoxifen include high blood pressure, weight changes, hair thinning. Check with your healthcare provider if you have any side effects that seem to interfere with your daily activities. Targeted therapy. Targeted therapy uses drugs that block the growth and spread of breast cancer cells. Targeted therapy may block the action of an abnormal protein, such as HER2, that stimulates the growth of breast cancer cells. Trastuzumab, also called Herceptin, for example, may be given to a patient whose lab tests show that the breast tumor has too much HER2. This is just one example of the targeted therapies available for women with HER2-positive breast cancer. Scientists have developed other targeted therapies for different types of breast cancer. These can help women who have hormone receptor-positive breast cancer and those with BRCA or PIK3CA genetic mutations. As with all cancer treatments, targeted therapies can cause side effects. Mild side effects may include tiredness or nausea. More serious side effects, such as severe diarrhea or heart damage, can happen. Ask your healthcare provider to learn more about your treatment options and their side effects. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Breast cancer is a common condition that affects 1 out of every 8 women. Your healthcare provider may recommend hormonal and targeted therapies for your breast cancer. Hormonal therapy is also called anti-hormone treatment. If lab tests show that the tumor in your breast has hormone receptors, then hormone therapy may be an option. Hormone therapy prevents cancer cells from getting or using the natural hormones they need to grow. Targeted therapy uses drugs that block the growth and spread of breast cancer cells. Targeted therapy may block the action of an abnormal protein, such as HER2, that stimulates the growth of breast cancer cells. Hormonal and targeted therapies, as well as other adjuvant treatments, reduce the risk that the cancer may ever come back, but they do not guarantee a cure. Hormonal and targeted therapy have some side effects and risks. Knowing about them will help you detect and treat them early if they happen. Thank you for using Explain.